Several years ago, Evansville was ranked as one of the most obese cities in the nation. Currently in Indiana, 1 in 3 adults are obese, another 1 in 3 are overweight. And those extra pounds cost us all, not only in our health, but also, it turns out, in our economy. A new report by Global Data shows obesity and overweight issues caused a staggering $9.3 billion reduction in Indiana's economy in 2022. So joining us now to talk about all of this is Jennifer Ferrer, Executive Director of Wellness Council of Indiana. Jennifer, thank you so much for joining us. We appreciate it. That is a huge statement, $9 billion reduction in Indiana's economy. Tell us, how is this determined? How do obese and overweight Hoosiers affect the economy?
Yeah, we see so many. Diabetes is complicated. Obesity is complicated. We have so many things that are impacting it, and it is. It's impacting our ability to show up at work, to do our best jobs at work. And if you're a female in the workforce and you're obese, that you see a 9% reduction in your earnings. So it's affecting the way that we live, work, and play in our communities. And with obesity, there's so much science behind it. It's so important that we continue to understand and educate ourselves onto the science of obesity, because it's not just a eat less, move more conversation. It is so much more than that. And we need to be looking to understand what these new obesity medications are impacting, what other resources are there. And if we can do better about educating ourselves, we can find those tools that might help us.
So I understand, so you kind of touched on the fact that it affects our workforce. Obesity and overweight issues affect our workforce, but also healthcare costs, right?
Yeah, healthcare cost. When we look at the healthcare cost attributed to obesity and being overweight, it is $1.2 billion for employers. And that is very low estimate, because, it's not just the individuals or the employees that are impacted by it. It's also their family members and everybody else that's being on that insurance plan that might be trying to access this care. So, we have a lot of work to do in the state of Indiana. But yeah, $1.2 billion for employers is a pretty hefty price tag.
And you touched a little bit just a second ago on the effect on women, the fact that there's a disparity there between obese women getting paid less, earning less than other women. And I'm wondering, is this just women? Do men experience this at all?
Oh, I think that it does not really discriminate based on gender, and I think that we can see that in so many different ways. But what we do know is that the absenteeism related to obesity, the disability costs associated with disability, really do add up, and we're talking, $900 million in health-related absenteeism and disability costs for the state of Indiana.
Okay, so this report also suggests some action items to be done that lawmakers can do and also that employers can do. Talk about some of the things that we can put into action to kind of address this.
I think what employers need to be able to do is really understand the impact, look at their data, look at what their benefits are offering, and make sure that there's alignment in what they believe that they're offering to their employees and the actual benefits that they're providing, because sometimes there is a disconnect. And what we've seen in some businesses and some employers is that they're willing to cover a bariatric surgery, but they're not willing to cover a weight loss medication. And there's reason for that, but there's also, we need to better understand the long-term impact that this is having on our workforce.
The report also talked about what lawmakers can do. We don't have a whole lot of time left. Can you kind of quickly go into some of the things you'd like to see lawmakers address as well?
Well, when we look at the impact of obesity and we look at the Medicaid population, $239 million in higher Medicaid costs associated with obesity, and that's what we as taxpayers are paying for. So we need to make sure that if we're looking at the impact of obesity, these numbers are significant, and employers and policymakers can do more in making resources accessible to Indiana Hoosiers.
Okay, Jennifer Ferrer with the Wellness Council of Indiana. Thanks so much for joining us today and talking a little bit about this that affects all of us. We appreciate it.
Thank you.